And segment 2 features Dr. Kevin Kavanagh. Dr. K is a retired physician and founder of a national organization called Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
How you doing, by the way? Dr. K had cancer surgery not too many weeks ago. Are you okay?
Doing very well and recovering. Luckily, it was low-grade prostate, and they told me, as I said, they got it all, which is good news. But Jack, they probably tell that to everybody. So all patients that have cancer kind of sit around on pins and needles, I guess.
Well, I understand. But the reason that I bring that up is point number 1 of the notes that you sent me is that Kentucky hospitals are starting to cancel elective surgeries. Now, in your situation, this was not an elective surgery, this was cancer surgery, but you had your surgery canceled due to COVID. You had to wait and go back another day. Tell us about that.
Well, and that's correct. Luckily, it was just a few weeks, but it was, I feel, postponed. In other words, to get the date in the first place was put off because of backlog of cases, and they had previously postponed due to COVID. And so it's very problematic. And when they say they're postponing elective surgery, that term elective really encompasses a broad number of surgeries. Basically, anything that doesn't have to be done within the next few days, they define as being elective or semi-elective. And so that includes biopsies, oftentimes would include low-grade cancers as things got worse. And so all in all, it's kind of a code word for triage. They hate to use that word, but it's kind of distressing. And what we're seeing now is the dangers of infectivity versus case fatality rates. As we said before, infectivity is actually much worse. People have a hard time understanding that. What's very distressing is Kentucky still has a very low vaccination rate. I think only 54% of our population is fully vaccinated, compared to Portugal, that's 89%, and mainland China, that's 86%. So this is not sustainable. The United States, on the whole, is 61st in the world in vaccinations, which is kind of in the region of a third world country. And Jack, this just isn't sustainable. Now, we talk a lot about the death, destruction, and people who are developing long COVID and disease, but there's also an economic toll. In Kentucky, calculated by insurance allowables, we have spent $1 billion in COVID care so far. That's $500 million a year. That's just hospital care. And Jack, that's not sustainable. So when you hear some of our leaders saying, well, we're not going to wear a mask because we have to learn to live with the virus and go back to normal, that's not possible. This virus is endemic, but learning to live with the virus means changing how we do things. And high-grade N95 masks are part of that equation. Instead of poo-pooing the cloth masks and saying, oh, they're not that effective, don't wear them, we need to be concentrating on getting N95s to individuals and people to wear those so that we can keep them safe as possible. The other thing that needs to be done is ventilation. This was very high up in the recent report from the past coronavirus task force. It's just key. We've been talking about that for a year and a half. We've had facilities and institutions spend their COVID money on bonuses and, well, on sports tracks, rather than really trying to upgrade ventilation. And ventilation, I mean, you can just keep upgrading it. The better the ventilation, the better it is for mitigating COVID, because we need to get our cases down. We cannot keep going with this economic toll or with the toll of disease. And it's quite frustrating. And those that are younger are largely spared this, but they will still spread the virus. However, they still can get long COVID. I know a number of young people that are chronically ill, and this can go on for years and years. So we need to remember this virus is not the flu. It's highly infectious. It affects every organ of the body. And we need to start taking this pandemic seriously and doing things differently.
Chicago Public Schools canceled classes for a second straight day amid fight with the teachers union, which voted to switch to remote learning because of increasing COVID-19 cases. Which side do you come down on?
Well, kind of the middle. I mean, if you listen to both sides, they're talking about different things. One says you can go back to school safely. The other says, well, yeah, but, people aren't vaccinated. We haven't fixed ventilation. We haven't fixed masks. And, in order to go back safely, you need to have a safe environment. Granted, if you're vaccinated, you're not as likely to be in the hospital or die, but you still have the problems of long COVID. This is a cardiovascular virus as much as it is a respiratory virus. Cardiovascular effects are oftentimes silent until many years later. And so we need to take this seriously. I mean, Jack, if you were to say, well, we've got a new pathogen here, a virus, and it attacks the ACE2 receptor, how do you think it's going to do in the body? Everybody would say, well, let's see, I take ACE blood pressure medicine, ACE pathway, that's mainly cardiovascular. Yet everybody's idea is this is just respiratory. Granted, respiratory is a big part of this, but it does affect every organ of the body. Even your smell, that's not peripheral receptors, that's infection of the brain. And so I think that they're both right. Until schools start requiring masking, high-grade masking, fix ventilation, start requiring and mandating vaccinations, we mandate vaccinations for children for other pathogens. We're going to need to do this in order to create a safe environment so we can get teachers back into school and we do not have children spreading this virus to others.
Let me jump in here because we got calls and texts. Let's go to Shane. You're on with Dr. K. Good morning, Shane.
Hey, good morning, Jack. It's been going on, I'm guessing, close to 2 years. This show's been on every Friday.
Yeah.
And the amount of information, the fear-mongering, the things that we know are demonstrabably not true, and it just keeps doubling down.
What's not true?
What is true is you're going to have to be spending either tons of money or looking at inflation due to the health care bill. At some point,
this virus is running its path
we're not
the
in a
same
problem.
as all viruses run their path. Omicron is far more contagious.
This is different.
It's far more contagious. Listen, here's the problem with this guy, Jack. And your viewers, your listeners, are tired of this guy.
Right.
I can't get a word in edgewise.
Okay,
he's got it all figured out.
You say your piece. We'll get Dr. K to hang back here, and then we'll let him defend
thanks,
himself.
Jack.
Yeah,
I appreciate that. I appreciate that. So this virus is following the same path that all viruses do. Omicron, whatever's next, is far more contagious and less deadly. It from day one, there have been those of us who have said, it's a virus. This is not, the laws of man and our universe have not been suspended by this thing. What is killing people is this failed policy of just stay home, don't come in until it gets to where you can't breathe. And then when they get there, and they completely turn their back on all the various therapeutics that have shown very effective in places like India. And the vaccines are nothing more than a therapeutic. We now know that. Let me ask him, has he came on your show promising early on that the vaccines were going to stop this? That if you got the vaccine, you couldn't get it? Because that's demonstrably false.
Okay, I don't think he's ever said that. Thank you, Shane. I'm going to let you think about your answer here for a second because I have to take a break. Platform back to you, Doctor, to respond to our caller going into the break.
Well, this is one of the reasons why we're not able to effectively confront this pandemic. The concept that this is like any other virus is ridiculous. We are in our fifth wave. We are spending an unsustainable amount of money on our healthcare industry to combat this virus. Just hospital care alone, as I stated, is $500 million as calculated by insurance company allowables, and that is just in Kentucky. So we can't keep going the course we're going. People are not able to access the healthcare system. The system is getting overrun, both because the hospitals are filling with COVID patients and because our healthcare workers and frontline workers, even though they're vaccinated, they're getting sick, maybe defined as mild, but they have to be at home and aren't in at work. So it's sort of a double whammy. This is just unsustainable. Therapeutics, we have limited therapeutics. You can try to wishful think that, well, this drug will work or that drug will work, but all of those drugs have not been shown to be effective. And I'm talking about ivermectin and hydroxychloroquine. Hydroxychloroquine was used like water during the beginnings of this pandemic. Millions of doses were sent to Brazil, no effect. In the United States, there was a drug shortage. People who had lupus and rheumatoid arthritis didn't have access to the drug, yet it did little to dent the pandemic. So this is just really talking points that you hear on the internet, which in my opinion is no better than reading your spam folder. This will not work. We need to start taking the virus seriously. This is not sustainable because the bill for the medical care is going to come in taxes or it's going to come in inflation, and everybody is going to be paying for it. And we need to get a hold of ourselves and say, look, we have to live differently. We have to upgrade our masking. We have to upgrade our ventilation. This is just key. And Jack, we also need to start running our testing facilities and our interventions 24/7. Where if I get a test on Sunday, I have to wait a day for the results, or it's hard to find a place to get tested on Saturday and Sunday. This is not acceptable because with these therapeutics that are going to be available within the next couple of weeks, they need to be given early on, within the first 3 to 5 days after diagnosis. And we don't have a good system set up to get a rapid test or a PCR test that can be having the results back the same day and then be plugged into a therapeutic quite rapidly. This is not this is not the case. So you can get a test, but how do you see a doctor? How do you get your test results? And getting a test on Saturday and Sunday may be problematic. So we need a new system. We need to start taking this virus seriously.
Over 4,000 U.S. children hospitalized on Wednesday due to COVID-19. CDC, and now that, by the way, was a record number. Just weeks ago at Christmas, that number was about 2,000 or less. CDC Director Rochelle Walensky said on Wednesday, it's critical that we protect our children and teens from COVID-19 infection and severe disease. Your reaction?
Well, that's correct. This wave with this variant is actually, in my opinion, more dangerous for kids than the previous variants. And the health of our children is important, as is the health of their caregivers. Well over 100,000 caregivers of children have succumbed to COVID-19. And so they are key in stopping the pandemic. They can both get sick from this, although it's not as likely as adults, but they can also spread the disease. And in times when we have viral spread is high, our primary healthcare providers, along with other frontline workers, are at risk of getting infected, and these systems are under strain. We need to decrease community spread using every tool in our armamentarium.
Dr. Kevin Kavanagh, thank you so much. We'll talk to you Monday.
Thank you, Jack.